Appendicitis, inflammation of your appendix. So, what does your appendix do? Exactly. It's just an accessory organ, so really it doesn't do any harm or do any good to have it in your body. The pathology behind it is that the obstruction of the lumen results in distension of the GI tract, so that starts to get larger. There is venous engorgement, meaning that more blood and inflammation is coming to that area. And there's a larger accumulation of mucus and bacteria, which some bacteria is good in your GI, but you don't want it all in one area. And that can lead to further complications such as gangrene, perforation, and peritonitis. The most common causes, or cause, is just the obstruction of the lumen by a fecalith, which is that mucus and bacteria buildup we were talking about before. And usually it happens about to the age range of 10 to 30-year-olds, and about 1 in every 15 Americans gets it.
There are subjective and objective clinical manifestations of appendicitis. Remember, subjective data is information from the patient's point of view, such as feelings and perceptions. The patient may describe pain that begins in the periumbilical area and moves to the right lower quadrant. This area is called McBurney's point, and it is 1/3 the distance between the right iliac crest and the umbilicus. The pain felt is usually persistent and continuous. The patient may have no interest in eating and feel nauseous. They may have the inability to pass gas, have severe cramps, painful urination, and a dull or sharp pain anywhere in the upper or lower abdomen, back, or rectum. The pain will likely be intensified with coughing, sneezing, deep inhalation, walking, or any type of jarring movement. Objective data is information that we as nurses can observe and measure. Objective clinical manifestations may include vomiting, which can occur before the abdominal pain starts or shortly after, and diarrhea. Upon physical examination, there may be localized tenderness with applied pressure over the abdomen, and rebound tenderness, which is felt upon removal of the pressure. Muscle guarding, which is tensing the abdominal muscles to guard inflamed organs, may be observed. You may see abdominal bloating. They may have a low-grade fever of 99 to 102 degrees Fahrenheit, but a fever is not always present. Often the patient will lie still with the right leg flexed up for comfort. Some other things to consider when assessing a patient with suspected appendicitis is that geriatrics may report less severe pain, slight fever, and discomfort in the right iliac fossa. A pregnant patient may complain of pain in the upper abdomen because the appendix is displaced higher in the abdomen with pregnancy. There are no lab tests specific to confirming appendicitis, but the following are often performed. A high white blood cell count can indicate that there is indeed an infectious process in the body. 70 to 90% of appendicitis cases have mild to moderate white blood cell elevation. And there are many other abdominal and pelvic conditions that can cause the white blood cell elevation. A urinalysis is performed to rule out conditions that mimic symptoms of appendicitis. That can include a urinary tract infection, kidney stones, and an ectopic pregnancy. Common imaging tests to help confirm appendicitis are ultrasound and a CT scan. A CT scan has been shown to be more accurate than ultrasound in detecting acute appendicitis. However, ultrasound may be preferred as the first imaging test in children and pregnant women because of the risks associated with radiation exposure from CT scans.
IV fluid replacements, which is necessary to replace electrolytes because patients generally have a lack of appetite when suffering from an appendicitis. Antibiotic therapy is started before the appendectomy is performed and well after post-op, especially in patients who are experiencing peritonitis. Analgesics such as morphine are necessary for the pain often experienced when an appendicitis is occurring. Parenteral nutrition is often necessary because patients lack appetite before diagnosis and NPO status awaiting surgery. A blood transfusion may be needed if a patient's appendix is ruptured, which creates peritonitis and possibly causing sepsis. The main treatment of an appendicitis is an appendectomy, which is generally performed laparoscopically and is performed as soon as possible. Post-op care is similar to the care of a patient after a laparotomy. Observing the patient for any post-op complications such as peritonitis is important.
Nursing diagnoses related to appendicitis may include the following: deficient fluid volume related to anorexia, nausea, and vomiting, acute pain related to inflammation, activity intolerance related to pain upon movement, impaired comfort related to abdominal pain, imbalanced nutrition less than body requirements related to loss of appetite, sleep deprivation related to prolonged discomfort. One complication of appendicitis can be peritonitis, which is an inflammatory process of the peritoneum that can be caused by a ruptured appendix. Manifestations may include tenderness, abdominal distension, fever, tachycardia, tachypnea, nausea, and vomiting. Further complications might include hypovolemic shock, sepsis, intra-abdominal abscess formation, paralytic ileus, acute respiratory distress syndrome, and possible death. Prevention of potential complications requires immediate surgical removal.
And that concludes our presentation on appendicitis. Any questions?